Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. Today, I am here with my non-hematomed co-host, Dr. Millicent Rovelo, who is fresh back from her vacation, looking great. How are you doing?
I'm doing really well. And I think it's because if you took my blood alcohol content right now, I'm still like 5% Mai Tai.
Oh, there you go. Nice. That's good.
Yeah, got back from vacation last night. I was at the house at 11:30 p.m. and I was at the office at 7 a.m. No rest for the weary, but here we are.
Good job. Thanks for coming in to do this. We have some stuff to do today. I am the hematomed co-host, which is why I am wearing this collared shirt today.
I know. You walked in and I was like, why are you wearing a shirt and tie?
Well, because I was doing a little training session this weekend for one of our future nurses, who I'm not going to spring that big news just yet, but that news is coming. And one of my PAs was doing the training, and we were doing a little neck Botox. And
the platysma bands, those bands that pop on your neck, and you can Botox them to relax them.
Which do look better.
Which I'm sure they do.
They do. Other than what's going on down in this general vicinity below the collar, because evidently the jugular veins got in the way of some of the platysma bands. So
those have a lot of blood in them.
They do.
They don't like being stuck.
I think I took a little bit of a beating. Taking one for the team, so I could train. But anyway, here I am.
And BT dubs, that's not the platysmas. Usually, you don't stick the external jugulars.
You want to avoid that if possible.
Yeah, that's not really a thing.
But I think it was just there was some nerves, injecting the boss and that sort of thing. So I'm gonna take the pass on it. I took the L in terms of my look, and I'm just going about my business here. That's all I can do.
Sounds good.
So good news today. The Newsweek rankings came out for the top plastic surgeons in the U.S., and I was happy to see them. And I will note, though, that I was no longer number 3 in rhinoplasty anymore.
Uh-oh. What are you?
Number 2. Woo! So that was good. I was happy about that. I do feel that those rankings are worth something as opposed to paid rankings and paid listings and paid this and paid that. I feel like that Statista company really makes an effort to try to get to who the best plastic surgeons are in the eyes of other plastic surgeons.
Right, because that's how they are voted on. Supposedly, no one's ever asked my opinion, and I have opinions, but no one's ever asked me.
You haven't done the survey?
I have never received a survey.
So you need to get that survey.
Because it's a survey of other plastic surgeons voting on plastic surgeons. So it's not like, a social media ranking. It's not who pays the most for, SEO stuff. It actually is as ranked by other plastic surgeons.
Correct. And the way that it works, because I did the survey again this year, and it's very specific. You cannot, as the plastic surgeon, I cannot vote for you because we work together in a capacity that is identifiable.
Right.
If you're in a surgery center conglomerate together, if you are in a department of plastic surgery together, if you are at the same university together, if you are business partners, you can't vote for
any kind of vested interest,
correct,
mutual benefit.
Right. So, you can't vote for me to make me go up the ranks so that your business does better due to me being seen as a top plastic surgeon. So that's why I think it's so valuable, because when I do the survey, you really have to look at it very carefully. It says, and other than these people, if you're I think it even says if you're on a board together, so that if you're on a board of an organization together, anything where you have a direct, business vested interest relationship, you cannot vote for those people. And if you do, your answers will be excluded from the survey. Right. And I know they do that because the first year they did it, there were 7,500 or 7,300 surveys, and then the year after there were 4,800 or something. It had dropped significantly. Right. So clearly, they didn't send out less surveys.
Yeah.
They clearly went through and said, this one's no good, this one's no good.
Right.
So the survey is really, I think, pretty ironclad in getting the opinions of plastic surgeons, because having done the survey now 2 years in a row, when I do it, I really you can't vote for yourself, all that sort of stuff. So when you look at it, you really have to think it through. Who do I think are the best plastic surgeons in these categories. And so there's rhinoplasty, which again, I jumped up from 3 to 2, which I'm very happy about. That's great.
What number are you on the West Coast?
Well, that would, I mean, if I'm number 2 in the nation, I'm at the, and Gavami was still number 4. It was me and Baum and Gairon switched positions from 2 and 3. I think if you're in the top, 50, you've done really
pretty well.
Yeah, that's a really good rhinoplasty surgeon in the eyes of your peers. By the way, for the patients, doesn't mean your rhinoplasty is going to be any easier. Doesn't mean anything. It only means that you're going to somebody that is thought of as somebody who can actually do these procedures by their peers. Results have, they're not guaranteed, none of that stuff. So I jumped up into the number 26 on facelifts, which I thought was great because I am speaking a lot about facelifts and doing a lot, obviously. I think I've done like 7 in the last like 3 weeks or so. I got 2 tomorrow. So facelift and rhinoplasty are my main things, and obviously the breast stuff, which I was still in so they only rank the top 30. They show you who the ranks are for the top 30. If you're in the 31 to 175, they just lump everybody in 31 to 175 together, saying that you're ranked, you don't know where it is. They don't publish that, which I guess is smart. It just, because what's the difference if you're 32 or 78 or 175? The 175 guy is going to be, teed off that he's 175, and the guy that's 32 is going to be, angry that he's not, 30 and his name mentioned separately. But I think that's their choice, and I think it's smart. So the top 30, and I was number 30 for eyelid surgery for blepharoplasty, which I think I do a pretty fancy blepharoplasty. I thought that was kind of warranted, and that may be because of all of my mid-face stuff that I do, where I do that lower lid stuff, and I talk a lot about it at meetings. And then ranked for liposuction and breast in the 31 to 175 category, which is great. But I think that survey is important. And I think if you are a plastic surgeon and you get the survey, you should take a minute and do it, just because it does kind of signal to those of us who are, trying to teach and trying to running a fellowship and all that, you're doing a good job. Like we believe in what you're doing for the specialty, and that's important. Rod Rorick was, I think number 1 in a few of the categories, and well, he should be. He's done so much for plastic surgery. He's incredible. Bill Adams was number 1 for breast surgery, which again, this is a guy who talks a lot about breast surgery and does a ton. He publishes, he, and that's who I think people know the names and they know their work, and they go, if it's not the people around me, like these are the guys. So I thought it was good. Did you see it at all, or not yet? This is the first you hear of it.
This is the first I've heard of it. Everything's brand new.
Big news, right? So I'm happy about that. I'm happy that I was recognized. I am grateful to my peers for recognizing, my contributions, whatever they are. I'm grateful that the patients, still come here and get surgery. It's great. And I do. Every time I walk in the operating room, I say a little prayer for my patients that today is going to be the best operation I've ever done. And well, it should be, because it's what I'm up to.
You're up to.
That's what I'm doing at that, right? I don't walk in and go like, no, I walk in and I go, here we go. This is it. This is the best. This is going to be the best facelift I've ever done. This is the best rhinoplasty I've ever done. And I think you should have that attitude if you're a surgeon. I think that's really how it needs to be.
I could not agree more. I love it.
And, Dr. Rovelo, I wanted to show you because some things in plastic surgery are not all peachy lately.
Okay.
And I hate to spring this on you, but I know I've set you up for this because I want you to see it. I did a little TikTok last week. Why don't you watch it?
Okay.
It's just go ahead and watch the TikTok right now. It's on my it's on my TikTok account. And for those of you, if you're trying to find my TikTok account, there's about 78 fake ones. The real one has Dr. Jake. It's Dr.Jaycalvert, Dr. Calvert. And you can tell it's the real one because there's one of the pinned videos has 1.3 million views. So if it doesn't have 1.3 million views, that's not it. It's not it.
You want to know a funny aside? So my son said that he started following you, a week or 2 ago. And he's like, right after I started following Dr. J. Calvert, I got 3 more requests from fake Dr. J. Calvert.
Yeah, there's so many fakes.
He was like, if I followed the real one, why would I follow these fake ones with 5 followers?
There are so many fake accounts.
He's like, the bots.
Yeah, that's the deal. It's unfortunate. But anyway, so go ahead and watch that video.
And for
never
those of you
seen
watching
this
at home, before. This is my honest reaction.
All right, so I'm looking at one of the latest Instagram posts from one of the prominent Southern California facelift surgeons. And I will tell you that it bothers me. So blue background, hair pulled back up in a ponytail, and the after, hair is down because this surgeon makes cuts on the face, etc. Hair's down, it's done. There's a filter on the after. Patient is smiling, and there is no blue background. This is being put up on Instagram, right here on my phone as a before and after. That is a way for patients to evaluate whether they want to come to the surgeon. It's just not true. And I know it's Instagram, and everybody says, oh, it's just marketing, go to their website. Well, it's on the website too, the same one. I think that it's unethical. I think it's just not, it's not the way to do this. And I think if you're going to show the afters all done up, then just show a patient with a filter and done up, and don't say this is the before and after, because that's not a medical before and after. If you are trying to evaluate the photographs, you should have a way to look at the before and after and say, is this a fair assessment of what happened? Because the filtered after with a medical before doesn't make sense to me.
No, not at all. No, that's great. I think we've said that on this podcast like a gajillion times. Like the filters and the smiling, happy faces of an after photo don't make any sense. Like if your before is this like no makeup, 5 a.m. shot of a person against a blue background.
Right.
With like crappy office lighting.
Yet that it's okay. Like it's being done constantly.
Yeah.
It's being done, and I'll also say somebody who was in our office and who works for somebody else, I showed them that video and said, hey, this is getting a lot of action. And they said, oh yeah, I mean, like everybody face tunes their before and afters. I was like, I don't.
Excuse me?
I was like, what are you talking about?
What do you mean everybody? No. You face tune the picture of yourself in a bikini. You don't like face tune your medical after.
I would hate to see myself in a bikini.
So you face tune it.
Big time.
Body tune, yeah. Ooh, look at that waist. Look at that booty.
No. But I do think that so not only is that TikTok gotten a lot of comments, and the comments are like this, no way, or, like, how do you know it's a filter? And people are sort of up in arms. But I will tell you that I've had 2 patients come in for facelifts already who like looked at it and said, first of all, they named the surgeon that was doing it, like off the bat. They said, I was thinking of going to Dr. So-and-so. And as soon as I heard that, I was like, I knew it. They were just like, of course they're fake. There's no way that can be real. I said, I don't know what you're talking about. I never said a name because I didn't. Right. Additionally, my wife was out to dinner with 2 of her friends, and one of them said, well, Dr. So-and-so, he I don't know, why he has to do that. And, I heard Jay talking about Dr. So-and-so on his TikTok, and Chris was like, he didn't say a name. Yeah. Like, so that's how hopefully obvious it is to people. But, we did a whole episode about Photoshop and plastic surgery because it's totally unethical. It's not right. It doesn't make sense to do that to people. And, to get them, fired up that they're going to have these like dream results, like you need to show medical before and afters, or as I say, if you want to show a glam shot of your patient,
do a glam shot before.
Show it in isolation. Yeah. Don't show it like, here's what they looked like before and here's what it looked like after. I have glam shots of my patients, that they send me, and I'm like, oh my God, they look great. But it goes up as a glam shot of that patient. There is no before saying that this is the after. If I show a before and after, it is in front of that blue background with all its, ugliness of no filters, no nothing, the same light just blasting on the patient, and this is what it looks like. And they always go, oh, can I put some makeup on? I'm like, no. And it is hard to get them to take their makeup off for facelifts and all that stuff. But, at the same time, it should still be a medical before and after if you're going to do that. Right.
So how do you know that there is a filter on it, as one of your people commented? How do you know there's a filter? Because
you'll see the fuzziness, the blurring of the crisp. Things that should be crisp are also blurred, are also fuzzy. It's very easy to tell the filters today. And And obviously, I've also talked about a rhinoplasty surgeon that uses a video filter when he's videoing his afters of his patient sitting in the chair. And somebody named that surgeon on the button based on that description because his face is distorted in the background while the patient's face looks beautiful and perfect with the filter on it. He looks like sort of alien-like because the filter's not quite getting him in focus. Yeah. And so he looks very bizarre. And so those things, and the reason I bring it up is for patient awareness. And I am happy that TikTok resonated with patients enough that they were just like, oh my God, like, is that actually happening? Because they should be outraged. They should be shocked. They should be upset. And the people that go there and get these operations done because they want to look like these glam shot afters, well, then go get a glam shot after. Don't spend, these, inordinate amounts of money, these crazy numbers to fall for that kind of BS. That's why I love some of my buddies who do facelifts show their afters or them standing next to their patient with a video on with no filter in front of a blue background. And you know what? That's an honest, honest depiction of what's going on. That's like when I have my patient sitting in a chair, I'm like, here they are after their facelift. Look at these incisions. I want to show you how this works because then you know what you're signing up for. It's reality. And that's what we need in plastic surgery because it's your body, it's your face, and it really matters.
It super duper matters. And that's why you're climbing the ranks in the facelifts.
I hope so. I mean,
you're coming for number one with the rhinos.
I don't think that's happening. I think I have to wait for Rod to retire, and he'll probably still be number one.
He probably still will.
He might be number one posthumously. It's like, well, he's 127 years old today. If he were still here, and
he's number one.
I don't know. He may make it to 127. That guy's kicking butt. But that's the thing is you want it to be an honest depiction of what you're doing, and that's why I made that TikTok. Because I was just. And Hunter, our video man was right there, and he could see the disgust on my face. Because that video, the before and after came up on my feed, and I was just like, come on. I was like, are you kidding? Like, are you really passing this off as your before and after? Like, I was just, and he was like, ooh.
Ooh. Hold that. Save that for the cameras.
Say that again. It was like, what's going on? I was like, I'm looking at this before and after. And I was just, it's just, like, how can I compete with that?
Well, that's the other problem, right? Because the rest of people who are doing the legit befores and afters, people are going to look at it and be like, eh.
I don't want to look like that.
Yeah.
That person looks normal.
Right, exactly.
I want to look like I just walked off a movie set.
Yeah, me too. Same.
You kind of do that.
Where's my wind machine?
Yeah, Jen Kiner brings a wind machine when she plays with Foxy Koda.
I know. That's what I was thinking of. I saw her playing, and I was like, damn, how do I walk around with one of those?
Get a wind machine for the office.
Yes.
So when you walk into the patient room, it's like...
That's when an intern followed me around.
We're just fanning you. or like a couple of fans and a light pad. I could see that. Yeah, but that's the thing. How can we compete as ethical plastic surgeons trying to demonstrate what we do in a honest and clear manner when we're being sort of out-marketed by, people that, and there is a disconnect. I mean, in plastic surgery, if you face-tuned a before and after and put it up on your website and you were caught, you'd probably get disciplined by the board.
Yeah, no, for sure.
And we're plastic surgeons, right? So these other specialties who do facelifts, who are not plastic surgeons in the traditional American Board of Plastic Surgery sense of the word, they don't have that oversight. They're not going to get dinged by some ethics committee because there isn't one. They aren't going to get told to stop. Like cease and desist, or we're going to talk about your boards, or and that's the other thing too. If you get disciplined by the Board of Plastic Surgery, it goes to the Medical Board of California.
Just don't do
they
it.
report you.
Yeah.
So we have a lot of pressure on us, obviously, which we should, to do it the right way. And why should that even be pressure? You should do it the right way.
Just do it the right way.
Because I always say this, it is people's bodies. It is their face, it's their body, it's their health. There is no excuse for trickery when it comes to having people decide to have plastic surgery.
I couldn't agree more. All the young plastic surgeons out there, just don't do it. Just because it seems like everyone else is.
Don't do it.
Don't do it.
Go take the high road. It's longer. It's harder. But when you do the work, you can at least look back and say, I built this myself.
Right.
I did this. I made it work. I made these operations work for my patients, and they're happy with them. And you don't have to, explain yourself to anyone.
I agree.
Anything else about the rankings, about plastic surgery, about representing what you do? Just happy to be back in the saddle?
Just happy to be back here. Kind of. I mean, I'm getting there. The Mai Tais are wearing off.
You have and of course you came back, of course, with a huge body lift.
Yes.
It's on deck.
Up. Yes.
Right? Yeah, don't ease into it.
There's no easing in.
Don't ease into it. Yeah. Just get back and get in the saddle.
Yes.
All right. Well, and I think that's good for that patient. I think you'll do very well for them. I saw the case. It looks
great.
It doesn't look easy. They're not easy.
No, but
they're work.
He'll do great.
Good. All right, Dr. Rovelo. Well, in that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.